Good morning, good afternoon, everyone. Welcome to this month's webinar, where we're going to be talking about the current conflict, displacement, and health crisis in Haiti. My name is Andrew Schroeder. I'm the Vice President for Research and Analysis at Direct Relief and the co-director of CrisisReady, which is a collaboration between Direct Relief and researchers at Harvard University. We focus in on novel data sources and disaster analysis. And the current events in Haiti are arguably the most serious disaster to hit the country since the earthquake in 2010, although a very different type of crisis in the sense that it is manufactured by people in its entirety. Um, we're joined by a great group. I'm really excited to talk to them. Dr. Natalie Colas from St. Luke's Family Hospital. She's the medical director there. Sandra Pellegrini, who's the Latin America Caribbean specialist from ACLID, the Armed Conflict Location and Event Data Group. Xavier Vollenweider, Director of Mobile Data Partnerships at Flowminder, and Marie-Rose Romaine Murphy, who's the co-founder and the board president of the Fondation Communautaire Haitienne Espoir, Haiti Community Foundation, and Espoir Incorporated. And they have a lot to say on this topic. Just as a little bit of background, the current crisis was kicked off on February 29th with the wave of attacks that occurred that day, but did not start on the 29th. Clearly, there's a long history that predates the events that led up to that. And is ongoing at reasonably high intensity even today with attacks that have happened in the last 10 days on hospitals, financial institutions, police stations, the airport road. There's a widespread food security crisis. It's impacted every aspect of society and caused a mass displacement event. And so to start understanding that event, the order that we'll go through is to start with Dr. Colas, and then Sandra Pellegrini, Xavier, and to talk about displacement, and then we'll finish up with Marie-Rose. So without further ado, let me turn it over to my colleagues, and I will stop share. And Dr. Colas, take it away.
Okay. Good morning, everyone. I am Dr. Natalie Colas. As Andrew said, the medical director of St. Luke Hospital of Tabor. Today I'm going to talk in some minutes the impact of the violence on the health system, and according to my experience at St. Luke Hospital. For me, all started in July 2018 with the first wave of widespread violence in Port-au-Prince. And you have to hear the situation get worse with the presence of armed gang in almost all the neighborhoods of Port-au-Prince and the other city and the Haitian capital. And from here to date, we constant and instability intensified and vary from region to region. According to a recent UN report, more than 1,000 of people are kidnapping and homicide are increased more and more. Hundreds of thousands people are displaced. And in your hospital facility, we are faced with a lot of challenges. We have some employees, they cannot come to work, and because of the instability, because of the instability, the general insecurity affecting employees' attendance at work, and they have we have a brain drain in the country, loss of a lot of employees. St. Luke Hospital lost around 17 employees and 30 more for the other facilities. We have some difficulties to find qualified and experienced employees. We have inability, our patient have inability to come to the hospital, and sometimes when they come too late and a bad general status. Due to the insecurity of the main area, some medical health facility located in Tabor and Cité Soleil are closed. St. Luke Foundation have about 10 healthcare facilities, and we have 5 in Port-au-Prince and 5 out of Port-au-Prince. The 5 we have in Port-au-Prince face some difficulties to continue to work. For example, we have one center in Wharf Jeremy and Cité Soleil. This facility is closed since 2 months because the employees cannot go over there to take care of patients because of gang violence and lost bullet everywhere. The other problem we have is we cannot we cannot have supplies, medicine and supplies for take care of our patient. For example, we have 5 centers and out of Port-au-Prince, we have some difficulties to bring medicine in the south because of Mortison and Mariani. We cannot go over there, unfortunately. And we have a center in Tabor. This center work with in women health, and unfortunately, we located this center because the area is completely occupied by gang, and one of our employee was kidnapped. So we closed this center and we send all the supplies and the staff and the site of St. Luke Hospital for continue to care a woman, because in this site we do screening for cervix cancer. It's a very important services, so we cannot close it totally. So we just look at this site and St. Luke Hospital for now. We have for now at St. Luke Hospital a reduction in drug and supplies backup. So without any immediate option to refilling them back in the coming days, I don't know what we are going to do in the coming days. So it's really difficult to us to continue to work to run the hospital. For now, for the country, we have another problem because only 3 public hospitals are functional in the metropolitan area. We have General Hospital is closed, I think since January. General Hospital is closed. Most of the time when we have a big case that we cannot fix, Generally, we send this patient in general hospital where we have all specialties. But for now, when we have those cases, we cannot send them in general hospital because it's closed. And sometimes we are here to see the patient die because we cannot send him anywhere. So that's very, very difficult for us. And another example, we have sanatorium, the only center of reference for TB patients requiring hospitalization. This center is closed, has been closed for more than 6 months. And when we have a patient with tuberculosis, we cannot do anything for him because we don't have a facility that can accept this kind of patient. So that's another problem in our healthcare system. Fortunately for us at St. Luke Hospital, we have our own oxygen production. We don't have this problem. Until now, we can have oxygen for our patients. But I talked last week with some colleagues that told me the hospital cannot have oxygen because well, they make the oxygen. I think the factory where they made oxygen, it's at Cité Soleil, and they can go over there to buy oxygen for the hospital. That's another problem. Another problem we have, it's for blood transfusion. We cannot have blood transfusion for a patient with bad trauma or patient with gunshot. We cannot find blood for them. That's another big problem we have in our healthcare system. So far, what we do in St. Luke for our staff, just for try to protect them a little bit, we review the chief curtain just for reduce the traffic into the insecure street of the country. And instead of 12 hours of chief, so now we do 24 hours chief. And sometimes when a member of the staff cannot go home, if we have demonstrations of a roadblock or something else, we have a guest house and they can stay over there for 1 week, or it depends. They can stay over there, and if they cannot access to their home daily. And we provide transportation to the employees to encourage attendance. For patients and clients with chronic disease, we follow an outpatient clinic. We give them some prescription for 3 months, and we try to call them to do counseling to patients and to encourage them to take the medication, because sometimes when they have an emergency, it's really, really difficult for them to come to the hospital, because we are at Tabor. Tabor, it's a red zone. We have surrounded by gang at Tabor. So we encourage our patient to come 3 months or instead of every month for consultation, and because of the insecure of the streets. For the moment, what we do for the emergency, we run our emergency 24/7, and we can receive patients with gunshot, and with some donation, we try to keep some meds and reserve, I can say. I don't know for how many days we can stay like this, but for now we have a little bit um, medicine and reserve for for emergency patient. So the another thing we did, we encourage some patient, for example, our HIV patient, or to come to come to so HIV patient, some patient in displacement, to call us just for we can know where they are, and we can go to bring the medicine for them. That's one thing we do too. And that's I think that's what we do. But I have to share with you um, the some challenges we have in the daily operations. For example, in our site at St. Luc, usually we have some lost bullet on the site. We have some lost bullet every day on the site. And every day we have gunshot near by the area of the hospital. Um, um, it's one of the cause that sometimes our staff cannot come to the hospital, and so it's really difficult for us. We continue to give to take care of our patient, but until now we don't know for how many days.
Um, Dr. Colas?
Yes.
Thank you very much. I apologize, but I need to we can come back to a lot of these things in the discussion, but would you mind if we go to the next speaker?
Okay. Sorry, I
No,
was
no problem. No
I
problem. I
was
just
so
want to
slow
make sure we
and
get everyone in.
just
Thank you
okay.
very much. I really
Yes.
appreciate it.
Okay. Okay. No
I
problem.
want to be able to go to Andrea to help us contextualize the situation that you were just describing through the data that ACLED has been tracking on the conflict. So would you like to go ahead and share your screen? Okay, thank you very much.
Kendry. Um, Hi, everybody. Thanks a lot for the invitations. I'm Sandra Pellegrini. I work as regional specialist covering Latin America and the Caribbean at ACLED, the Armed Conflict Location and Event Data Project, which is a nonprofit and non-governmental organization that monitors conflict and disorder. So for those who might not be familiar with our methodology and project, we collect disaggregated data on political violence and demonstration activity from a number of sources, including local news outlets, and those are consulted on a weekly basis in order to provide updates to the data set in real time. So in the case of Latin America and the Caribbean region, ACLED's coverage goes back to 2018 to the present time. So today I'll be presenting findings drawn from our data on Haiti. So looking more particularly at how Haiti's gang landscapes has evolved, especially since 2021, and how changing conflict dynamics have affected civilians. So to start, I wanted to show you how political violence and demonstrations trends have evolved since ACLED began its coverage in 2018. So on this graph, you'll see in orange the number of political violence events that were recorded each month, and in blue the demonstrations. So I really think that this graph helps highlighting the different crises that Haiti has faced in recent years, and as Dr. Nathalie Colas was saying, this is not something that started yesterday. So we clearly observe, for instance, that there has been spikes in demonstrations since 2018 along the crisis. So we have 2018 with the pays lock, etc. Or you can even see here the recent increase in demonstrations that occurred in January, February, and that eventually led to the resignations of Ariel Henry. But if we focus also on the level of political violence, we also observe that violence has continuously increased since 2018, and especially so since 2021. The violence there has been driven mainly by gang activity, so massacres and rivalries between different gangs. over the control of specific area. But I think what's really striking, at least in ACLED data set, and shocking is the number of reported fatalities that is represented in red in the line on this graph. So we see that the violence has increased, but when you look at the number of people that have died as a result of this violence, you can really see that it skyrocketed in more recent years, and especially after the assassinations of Jovenel Moïse in July 2021. I think, in fact, if we compare, in 2021, ACLED recorded nearly 1,400 fatalities, which is more than the double than in 2022, which is more than the double than what we recorded in 2021. And the increase is generally thought, to have been the consequence of the power struggle that followed Moïse assassinations, which caused shifts in the network of support and alliances that pre-existed between gangs and their political and economic elite that has sponsored them. Which has led gangs to basically seek for alternative source of revenues, grow more independent. And this is something that we have seen in the rising numbers of kidnapping for ransoms, but also gangs seeking to expand to new territories to control economic assets, which again led to an increase of violence and also an increase of violence related to territorial wars between rival gangs. So what's actually behind this increase in political violence and fatalities? So here we disaggregated political violence by year and interactions. And you can clearly see that all kinds of interactions have represented here have grown deadlier. So in orange, you actually see the number of fatalities associated with each interaction. A significant share of the recorded fatalities occur in the context of gang-on-gang competition, so clashes between gangs, again, as part of their territorial war. What's interesting is that, well, the number of clashes did increase, but what particularly increased is the number of fatalities that stem from them. So it could be, gang member killed, but it could also be civilians caught into the crossfires and dying during those clashes. We also observe a similar pattern in terms of non-state armed groups targeting of civilians, so essentially gangs here again, which occur along gang incursions in specific neighborhoods and makes up the highest share of fatalities compared to other interactions. So here I think it's really crucial to look at the number of fatalities to really understand the severity of the situations and the distress that has faced the Haitian population. Another notable increase in 2023 has been that of vigilante violence, which has both increased in frequency and deadliness. So we have recorded events of vigilantism before, but we really see that rising levels of violence and the government's inability to address insecurity has increasingly led civilians to take justice into their own hand, notably in the framework of the Bois Calais movement. And then finally, when we look at interactions between state forces and non-state armed groups, we also see an increase both in the frequency and its lethality. So we have seen efforts, from police forces to step up their operations and crack down on gangs. But I think what this trend is reflecting is, gangs' heightened incursions and targeting of police officers, of police stations, which here again is a clear indicator of the police lack of capacities to fight those groups who outnumber and outgun them essentially. I don't think this will come as a surprise, unfortunately, but on this graph basically emphasizes that the civilians remain the main victims of the violence that ACLED has recorded, making over half of the reported violence. And this is largely connected to how gangs have instrumentalized the civilian populations in their turf war, usually purposefully targeting and terrorizing the population in rival neighborhoods. Most of the violence targeting civilians have consistence of direct attacks. So in the context of gang incursions and fights in specific areas, but also increased numbers in kidnapping as part of gangs' diversifications of their revenue. And what we also observed in an increased use of sexual violence as a weapon of war by gangs. It's underreported, and especially so in ACLED dataset, but that's still something that is striking in the dataset. So with most of the violence largely driven by gang, I also wanted to show how the gang landscape has evolved in recent years with these bubble charts. So here you can see the number of identified gang that participated in violent event in 2021 and in 2023. And each bubbles represent a gang. So over the years, what we have observed is that the number of acting gangs have increased from 27 in 2021 to over 40 in 2023. Bearing in mind that a large share of the violence that we record is from unidentified gang. But not only have the number of acting groups increased, but you can also see that some gangs have actually stepped up their participation in violent events. So for instance, you will see that some of the bubbles in 2021 grew bigger in 2023. So I can, for instance, think of 5 Second or a Grand Ravine gang. These are just examples, but you can really see, how certain gangs have really increased their participations in violence. And this is a concern because increased fragmentations of the gang landscapes usually makes resolutions of a conflict more difficult. Ending a conflict is typically more difficult when you have a multiplicity of armed groups. So this is actually a worrying development in the context of Haiti. And then capitalizing on the prevailing climate of impunity, criminal groups have also intensified their campaigns to control new territories with a view to expand their extortion market and control the country's key resources and assets. So you can see here on this map, which is representing political violence in 2021, that the hotspots of violence is the West regions and the Port-au-Prince metropolitan area. If we zoom in and look at where violence concentrates, so in 2021, we record some of the highest levels of violence in the commune of Port-au-Prince and Cité-Soleil, which has been, traditional areas disputed by gangs. In 2021, we also record, a number of events taking place in Tabar, as has stressed Dr. Colas. But also increasing violence in Croix des Bouquets, and I think 2021 generally also corresponds with 400 Mwozo, increasing kidnappings for ransoms in the area. In 2023, we see that violence continues to concentrate in those areas, so Port-au-Prince, Carrefour, Cité-Soleil. In those areas, we also observe that gangs expand their violence. So for instance, in 2023, there were gang incursions in the neighborhoods of Carrefour Feuille, to cite an example. But what this map also helps to highlight is that violence has increased in Pétionville and Kenskoff, which until 2021 were generally spared from violence, being upscale neighborhood where the elite traditionally resides. So definitely seeing an increase there, which has also generated a strong vigilante response, which you can see here in orange. And also looking at beyond the Port-au-Prince arrondissement, you will see, well, in the east that violence continued to intensify in Tabar and also in Croix des Bouquets, which has also generated territorial dispute around this area. And if we zoom out in the broader West regions, violence is also spreading to the north of the capital. So I'm thinking of the Arcahaie arrondissement, where gangs like 5 Second have sought to seize key road access and infrastructures, for instance, the Lafitte au Port, or I think it's also really interesting here on this map to pay attention to those 2 dots that you can see at sea, which again shows, that gangs have basically tried to connect their stronghold from the Port-au-Prince to the north of the area by sea, and here again illustrating their increased capacities. At the national level, so as I was saying, the hotspot remained the West region, but we can also see in this next slide, which represents political violence in Haiti in 2023, that violence has expanded to other departments. The most striking example is the case of the Artibonite, where the number of violent events in 2023 doubled compared to the previous year. Here again, a number of kidnappings along Road 5 and 1, and usually gangs seeking to control road access to control access to the northern areas and seaports. I think it's also important to highlight the Centre region, where violence has also doubled in 2023 compared to 2022. And here again, violence concentrating mostly around road access as part of extortion strategy, attacks on bus drivers, civilians traveling on those roads. And I think this is a trend that is likely to continue and intensify in 2024. I think so far we already recorded nearly half of the number of events that we had last year, which is a worrying signs of growing violence in that department. I'll stop here because I think I'm by the hour, but yeah, thank you for your attentions and happy to answer any questions at a later stage.
All right, thank you so much. Really interesting. And I'd like to invite Xavier to talk about FlowMinder's work in understanding displacement using work from the mobile network. Xavier, do you want to take it away?
Thank you, Andrew. Yeah, so my name is Xavier Wallenweider. I'm Director of Mobile Data Partnerships at the FlowMinder Foundation. We are a non-profit organization. We're about 30 staff, and we work in Haiti in collaboration with the mobile network operator Digicel. So what do we do is that we process on-site mobile data from Digicel in order to get a better understanding of population movement across the territory. In so doing, we have benefited from the participation of members from the civil society in the Ethics and Governance Advisory Committee that kind of scrutinize our work as well as provide input into important questions that we should tackle, as well as help communicate the finding. We also work with a partner and collaborate with the IM working group, IM DTM, and other partner in order to streamline the communication about our finding. And yeah, just a quick word on the donor. So our work in Haiti is supported by the French Development Agency, Agence Française de Développement, Hewlett Foundation, the Swiss government, as well as the Bureau for Humanitarian Affairs. So when we look at the mobile network operator data, there are like some kind of key trends that we can observe. First, Port-au-Prince has seen its population decrease since 21, pretty much at a constant rate, while other big agglomeration, be it Cap-Haïtien or l'Écaille, is seeing an increasing trend in its population. It's really hard to get a good grasp about mobility in Haiti. The situation is very complex. You have both, if we think about Port-au-Prince, the kind of pay-lock situation where people cannot move, and at the same time, some sudden large-scale displacement caused by the episode of violence described earlier. Since January this year, what we have observed in terms of general trend out of Port-au-Prince is that the outflows that used to be kind of well distributed across the territory are now much more concentrated, limited to communes which are within the West Department, most likely because of the difficulty to travel out, and those communes are particularly Léogane and Kenoff. L'Écaille has seen a spike, and this is something that we had already observed in August, and then September, October, the follow-up of the clashes in Carrefour, spike of outflows. And naturally, the recent event started on the 29th of February, also led to large-scale displacement within Port-au-Prince. So our data at FlowMinder can be used as a kind of complementary source of information. There are other organizations, DTM, providing figures on displacement. And so our data are here to complement this source of information. What is important to take into consideration is that here the work is done with Digicel, one mobile network operator in Haiti. And hence there are some limitations, particularly when we do crisis reporting, we provide some insights on displacement of SIM card. We have another type of information product, which are much more longer term and which are distributed via a platform, which provides insight about population count. And these insights, these are the one on which I was grounding the observation about Port-au-Prince seeing its population decreasing over time. Important to know is that until pretty much now, the most recent data on this platform was kind of protected behind a paywall and under the control of Digicel. It was decided to make this data freely available. So for those who are interested, feel free to connect and seek access to the platform. You will gain access to the latest anonymized, aggregated data about population mobility based on the work of my colleagues that try to tackle all the biases and lack of representativity that are present in the data of a mobile network operator. I'm going to stop here and thank you for your attention.
Thank you, Xavier. And if you would like to put a link to Flowminder's work in Haiti in the chat, then people could check that out. It's great work, so thank you for highlighting it. All right, so our last speaker, Marie-Rose, do you want to take it away?
Thank you. Andrew, thank you for inviting me. My name is Marie-Rose Murphy, and I am the co-founder and the board president of Fondation Communautaire Haitienne Espoir, which is known internationally as the Haiti Community Foundation. It's Haiti's first community foundation. In terms of our focus as a community foundation, we're really looking at working with communities, for communities. We're a national network of regional funds. We started in the Grand Anse, and we're now in the Southern Peninsula. We do have a local, regional, national, and international network and focus on humanitarian, community philanthropy, and disaster, because it starts with community and it ends with communities. Talking about disasters, one of the things that we've set up recently was a rapid response fund, with Fonds Réponse Rapide, thanks to the support of the Vital Foundation. We also want to thank Inter-American Foundation for their constant support and other such funders that are really focusing on local and locally led organizations in Haiti. One thing that I need to, first of all, thank you. I want to thank everyone for their presentations. One thing that I want to do is to step back and then talk about the fact that most of the time people talk about Haiti as the poorest country in the Western Hemisphere. On the other hand, Haiti actually sits on quite a bit of untapped resources, such as oil, such as gold, such as iridium, which is actually more precious than oil and diamond, resources that has the interest of a number of stakeholders that are involved. So what I do want to say is that if you know that bit, you realize that it gives you a different perspective in terms of some of the geopolitical influences and aspects of the issues, okay? And some of the impact of this, because it is much easier to control a weakly governed country than it is to control a strongly governed country. So having said that, one of the things that is worrisome in terms of civil society right now, I mean, everything else, everything is, I don't think, forget about the earthquake of 2010, things have never been that bad. because you have to realize that even though, according to the Constitution in 1986, the country was supposed to have been decentralized. It never been. So there's been a concentration of just about everything in Port-au-Prince. We actually used to call it the Republic of Port-au-Prince. And it's been, an issue. It's getting decentralized now because of the issues with the gangs, but in a way that is unhealthy because it's not planned. And it's in a way that it's catastrophic to the extent where the provinces that have been largely ignored, okay, are not prepared for that influx. Actually, IOM has been monitoring some of the buses. My understanding is that from a recent report is that 116,000 people have fled Port-au-Prince to go to what is called the Grand Sud, the Southern Peninsula. And then in March only, we were talking about 53,000 people that left Port-au-Prince. 67% of these people were going to the Southern Peninsula, where actually our foundation operates. We had an emergency meeting this past Saturday, just discussing all of the different issues in terms of food security. Believe it or not, 1950, Haiti used to be food secure. Right now, we're 80% dependent on imports because agriculture has not necessarily been supported, okay? Neither by in a way that promoted self-sufficiency and productivity. It's neither been done by the Haitian government or the financial institution or the international organizations. One of the things that people are worried about is like, okay, because for 3 years, what we talked about was there were Haitian-led solutions that were proposed. There was a prime minister that was supported by foreign stakeholders that did nothing and became the most hated person in Haiti. The gangs proliferated. And then at this point, what are we talking about? Every piece of infrastructure is getting destroyed in terms. And one thing that I haven't heard mentioned, because obviously everybody, is the cholera epidemic, which is back. It's one of the top three countries, according to the UN, in terms of the spike. We have been dealing with it because usually it impacts it. Like everything, one of the things that we worry about, as a people, is the fact that people are focusing on symptoms and not on the roots of the issues. Because, for example, you have a number of gang leaders that are actually originating from the South. And a lot of the young people that have engaged in gang activities came from the provinces and actually from the southern provinces. Everything points out to the lack of opportunities. This doesn't happen overnight. And we all have a part of responsibilities. We Haitian people for not taking the stand necessary and having the guts to do what needed to be. Foreign stakeholders for keeping, staying and intervening and pushing their policies that put us in a vulnerable position and everything else. So what do we have? We have a disaster and people thinking, oh, this is a failed state. Well, what is it that people haven't tried? They haven't tried letting us lead our own country and having a community-led perspective and approach. It's never been tried. They can never leave us alone. So I just want to wrap it up. What is the solution? Well, on Sunday, we're having community representatives. We're bringing people from different sectors together and trying to address issues in terms of supporting agricultural production, making sure that security, because as all of you have mentioned, it's spreading, okay? So the issues of security are addressed. Trying to figure out, okay, what is it that we can do to help people move forward? Because the reality that even though you have international media, and frankly, I am so mad, everybody's mad about this. It's like, oh, the modern revolutionaries in terms of the gang leaders, Well, ask the women that are getting gang raped and the people whose houses are getting destroyed at every step of the society, if they want them in the government. Okay? You even have like a former ambassador who said that they should be part of this. Well, she's welcome to talk to them and work with them by herself. So people need to take responsibilities, all of us. And in terms of sort of like living it alone, I know that there are a lot of crises. But frankly, you know, it just really feels like it's all been about band-aids. It's all been about, you know, real flakiness. It's all been about infantilization of Haitian communities and community leaders and Haitian leaders. It needs to change. Thank you.
Thank you so much, Marie-Rose. I'd like to maybe pick up on what you were just describing, and apologies for the background noise. I'm doing this from the airport, but I'd like to ask everyone, but maybe we can start with you, about the role and responsibility of international NGOs in this particular moment. So Haiti, for a very long time, has been one of the most NGO-rich countries on earth in terms of the level of activity, number of organizations, et cetera. But this obviously poses its own problems. So what, given your focus on localization and the need for long-term locally led governance reconstruction, what are the roles and responsibilities of international NGOs in this moment?
What I would like to do is to separate action from intentions. Because I don't want to overgeneralize and say that there aren't good people trying to do good things as far as international NGOs. But let's look at the system and the way it is completely unequal. What do we have? We have a chicken bone that's thrown at local organization. We're never going to get to a Haitian a solution. And that's also part of in terms of the global south. When you're having, whether it's humanitarian, whether it's development, you know, a measly, you know, I mean, last year for humanitarian, it was like what, 1.02% that it went down of money going directly to local organization. This is ridiculous. Then you get development, okay? The same thing. So communities are not at the table. Everybody talks a good game when it comes to community-led. The decisions are being made in Washington, you know, whatever, wherever they are being made, you know, Europe and everything else. Okay. In the meantime, okay, we keep getting more and more dependent because even though people mean well, you know, they go with the cookie cutter, the data, the whatever, or something like that. And what is the reality? Even what is the reality today? I wake up in the morning, I have to worry about my family. Okay? People are taking tranquilizers because of the stress level. Talking about, you know, we actually funded, you know, Fadima because a blood pressure, cancer, the gangs are not killing you. All of these diseases are killing you. Okay? The country is systematically being destroyed. And it is just horrendous. It's hellish. And no one seems to worry about this. Meanwhile, the vacuum goes, and you've got these idiots that are supposed to be leaders of the government that keep fighting among themselves without focusing on their stability, which is about making sure that people can live. So what I'm saying is that international organizations keep talking about capacity building, capacity building, capacity building. You know, so much of this capacity could be solved if you just give us the money. Because the communities do know, can they appreciate the work, you know, working with international organizations? But talking about localization, I've been involved in localization and different things, all right? But the story is most of the time, what is it? It's this infernal idea that international NGOs come and they bring their people, they bring their supplies, they bring whatever, and it just wrecks our economy, and we continue in a slippery slope of extreme poverty and continued dependency.
Got it. Important observation, I think. I was wondering if anyone else would like to take up that question. In terms of the role of international organizations in this moment, how do we actually support a sort of improved condition or resolution to this crisis without contributing to the dynamics that Maria Rose is talking about? But if we don't want to take that up, which I guess is also like a hot potato, I'd like to make sure that we hit the question from the chat. Just Vincent, if you'd like to actually ask that directly, if you want to come off mute, you're more than welcome to. It's around data about healthcare facilities. So how do we understand sort of what's happening in the facilities that Dr. Colas was pointing us to narratively at the beginning of this conversation, but where is the data on impact on the healthcare system? I don't know if who would like to take that up.
Yeah, I could also elaborate. So good morning, excuse me, Vincent Torres. I'm the associate director for disaster response for the University of Miami's Global Institute. Our institute has been involved in Haiti for many years in supporting the healthcare infrastructure, and we're working on some projects and to see where we can help strategically. And one of the things I try to identify is anybody currently collecting active bed counts, active data, active resource needs at the various healthcare systems, like was briefed on at the beginning of the call. Specifically at hospitals, what's open, what's closed, what resources are needed, not only now, but long term. We all know that many facilities have been gutted and raided and a lot of things stolen. So strategically, I'm trying to identify what those resource needs are, so then we can help all these various communities and the government to identify what is needed when things inevitably, hopefully, get secure enough where we can start moving those resources back, obtain the resources and move those resources back in. So if anybody has an answer for that, that'd be helpful.
Thank you, Vincent. Dr. Colas, would you like to maybe take that? Or, I mean, even just starting about the data on the facilities that you were describing earlier, your own network, where is the data tracking for that network maybe, and how does that maybe kind of grow towards the systemic information that Vincent was asking about? Dr. Colas still on? Oh, you may be on mute.
Dr. Colas, you're on mute. Still on mute.
Sorry, I lost my connection. Sorry.
There you go.
So yes, for our healthcare network facilities, like I said, we had 10 facilities, but St. Luke Hospital is the biggest one. Only St. Luke have beds for inpatient, for hospitalization patient. So the other on rugs only and outpatient clinic. For now, at St. Luke, we are running 85 beds for hospitalization. We have surgery, elective surgery. We have outpatient clinic. We have internal medicine hospitalization. We have trauma care and orthopedic care. Until now, we have some, as I said, we have some medicine and supplies and reserve. So, but we don't know for the next week what we are going to do, because our reserve is completely decreased. Okay, so now we just figure out how to do for the week for the next week. We plan to I don't know, I think with the help of some partners, we are going to ask some supplies and medication, but we don't know if we will have them or not, because as you say, border is closed, border are closed. We don't have sea transportation, so we don't know what to do for the next week. We already tried to find someone in the government, but you know it's not easy for them to. I guess, but the government didn't. The Ministry of Health doesn't know exactly what to do. That's my personal what I think, because situation is really catastrophic. Some we cannot do planification for say, okay, tomorrow I'm going to bring some medicine in the south, or I'm going to bring some medicine and Jeremy or something. We have to try to contact someone in the area of gang for know if we can, yes or not, um, come to go to bring the medication. So that's one of the problem we have for our center and provinces. We don't know for the next weeks if we will be able to send medication to them. Unfortunately, as I said, we have until now some meds and supplies in reserve. And
great, thank you, Dr. Colas, and appreciate everything obviously you're doing for your country and your people. Andrew, he said he will connect us. I want to connect offline to see how we could help further.
Okay, thank you.
Absolutely, I'll be happy to connect you. I wanted to ask maybe folks from ACLED about health attacks. So there's been, I mean, this doesn't answer the question about bed capacity and the other health facility data that was described, but attacks on health facilities have also been quite significant in terms of their impact on the system. And so what is the data right now on the degree to which health facilities and other health workers are actually coming under attack?
Yes,
I'm sorry.
You want to go ahead?
You can, no problem. You can go.
In terms of attacks targeting health facilities, I'll need to double check, but I did take a look at the data set before joining up the sessions. And in terms of the targeting of health workers, we're definitely and this kind of goes back to what I was saying during the presentations. This has been picking up since 2021. So I think we observe, about sometimes around 20 attacks per year. But that's, again, the registry that we have been able to do mostly from open-ended sources, and I'm pretty confident that this is an underestimations. But yes, these are roughly the numbers that we're getting each year. As to the levels of how the health system of Haiti has been affected. I'll need to double check in terms of facilities, but in terms of individuals, that's what we're getting.
Got it. Thank you very much. Did you want to jump in on that as well, Dr. Colas?
No, that's fine. That's okay. Just just think about when we talk about the attack. I forgot to mention we have a center that was attacked by gang too, and yeah, and also it's in the last year. So it's closed
also,
now. So
got it. I mean, It's terrible. But I wanted to maybe also pick up on the comment from Marie Rose around the centralization of health facilities in Port-au-Prince, and then Xavier, your observations around the displacement dynamics. So reduction of population in Port-au-Prince, moving out to other places. How is this affecting the infrastructure and services in other parts of the country, since you're seeing, you know, a greater demand at places that are outside of the area of greatest concentration of services? And that's for anybody that wants to.
Yeah, just quickly coming on the question about the health center, and yeah, I haven't looked at the data on this specific question, but one possibility would be to look at the health catchment area before the situation got very complex in recent months, and have a better estimate of how many people were served, and then look at now traveling pattern to this location to get an estimate of how many people are deprived from access to this health service. So that could be something that may shed some light on the needs that are unmet because of the current political security situation.
If I may, in terms of the health facilities, I mean, there's always been a concentration in terms of one Port-au-Prince. I'll tell you, even before things got so bad, there are different hospitals. Like, one of the things is like, it's not just about supplies, it's about even energy. If I know a member of our network and a friend of mine was going to have his wife was going to deliver, so he knew to bring the gas for the generator, and you have to bring some health supplies. I just want to sort of like express and say, so right now, I mean, I know people are looking at gunshots and everything else, which obviously I mean, the people are getting killed, you know, I mean, domestic violence is, as Sandra talked, you know, something that underreported, but that's constant. But you also have issues, I mean, huge issues when it comes to cholera. One of the things, like in Saint-Louis du Sud, we actually, it's very interesting because this is actually the Haitian Red Cross. We just gave them a grant talking about education and prevention, because people will hold back, and you have the most remote resource, you know, places that, you know, and literally die for no reason. So the small clinics in the different communes, the ones that we've been helping, have been really overwhelmed. And obviously it's rooted in, guess what? Access to water. So, I mean, that's yeah, it's an issue, especially as people are, when you're seeing the exodus of people, if they are not leaving the country and being returned, you know, in big part, they are going into the provinces where the health facilities are completely, what is it? Undercapacitated. So, yeah.
Got it. Well, thank you very much, everyone, for your contributions here. I apologize. I actually have to board my plane now, but I want to thank all of our speakers. It was a terrific discussion. I'm happy to follow up with anyone that would like to connect with them. And we will be hosting the video and summary on the CrisisReady website shortly. Also want to call out the support that Direct Relief has been offering out to a range of partners, which you can read about on the Direct Relief website. But thank you very much, everyone, for all of your excellent observations and the work that you're doing. Thank you very much.